A nasal cannula provides low concentrations of oxygen, ranging from 24 to 44%. A nasal cannula is indicated for patients whose oxygen saturation is between 90 and 94%, or for patients that feel suffocated by a non-rebreather mask despite your best coaching and reassurance. A nasal cannula may also be indicated for patients who are experiencing nausea or vomiting and for COPD patients with minimal respiratory distress. A cannula allows a patient to talk without the obstruction a mask can cause, making it a lot easier for you to gather a history. Obviously, it is contraindicated for patients with nasal obstructions. A nasal cannula also should not be used with patients who exhibit chest pain, dyspnea, hypoxia, or signs of shock. Oxygen is delivered to the patient by two soft plastic tips, commonly referred to as nasal prongs, that are connected by thin tubing to the main oxygen source. The prongs rest a short distance inside the patient's nostrils. Now let's take a look at the basic steps that you can expect to follow when using this method of oxygen delivery. Before applying the nasal cannula, explain the need for oxygen administration to the patient. Attach the nasal cannula tubing to the nipple of the regulator. Set the liter flow between 1 and 6 liters per minute. The flow rate will depend upon the patient's condition, local protocols, or orders from medical direction. Insert the two prongs into the patient's nostrils. Make sure the prongs curve backward and inward toward the patient. Position the tubing of the cannula over the patient's ears. Bring the remainder of the tubing under the patient's chin and secure the slip loop by gently sliding the plastic adjuster in place. Do not make the tubing too tight. Remember to check the cannula position periodically to make sure that it has not been dislodged. Caution should be used when moving a patient with a nasal cannula, as nasal trauma can occur.